What were your symptoms before the surgery?
Left leg weakness, pain, numbness and tingling, and my middle of my back felt like there was 1,000 pounds sitting there all the time,
Okay.
and lower back pain.
How long have you had that problem?
A year and a half.
1 to 10, how about recipe?
Well, I've got up to a 10, and for a while I didn't get any better than a 6.
No better than 6. Now, the surgery was just about 6 weeks ago.
Correct.
First of all, how bad is the back? 1 to 10.
Probably just about a 3.
And how bad is the leg pain?
Really pretty non-existent, except just
Non-existent.
that SI joint.
That SI
That's
joint.
improving.
Yeah, yeah. Now, I'd like you to stand up with me. Take my hand and go on your tiptoes. Go on your heels. And start marching in place. How does it feel?
Good.
Feel good. Okay,
Mhm.
how's walking going? Please have a seat.
Walking is going good. I think I have been up to almost 2 miles.
2 miles walking, that's a lot.
And I haven't walked that much in over a year and a half.
Yeah. Now, your surgery wasn't done even in the hospital. We did your surgery in a surgery center.
Right.
We did a one-level fusion. And how long after the surgery did you go home?
And we are on the road by noon.
So about just 2-3 hours after the surgery.
I
you already-
walked to the bathroom at 10 o'clock.
10 o'clock. Okay, so you walked just about
Half
an
hour after surgery,
After
I
surgery,
walked
yeah.
and went to the bathroom.
Now, obviously, it's still a surgery. I poked literally, not figuratively, holes in you. And in your case, your bone was, if you want to get a close up, in your case, the bone was growing so bad all around here, I couldn't get a path. So what I did, I literally, not figuratively, I punched a hole in this area. Guess what? This is the sacroiliac joint, right there. So, and I punched a hole here. We call that transfacet olive, because in your case, this wasn't like that. The bone was growing all the way to get the job done. And obviously, if I punch a hole in your bone, you feel
Right.
that
So what caused that to
bone
do that?
grow, because that disc is a bad disc.
Okay.
And then it put too much stress in all the structure here. Look at that joint here. If it moves all the way wrong way, it just grows and becomes, we call that facet hypertrophy. We have a
Okay.
name for that.
Well, that explains why I was so black and blue. Because
Yeah.
I was pretty much as black as that from over my bra line
Yeah.
all the way halfway down my buns.
Because when I punch a hole there, it bleeds underneath and it goes under the skin and it just, discoloration, usually after a few weeks it goes away. Did that go away?
Mm-hmm.
And it probably will go, it will completely get normal within few weeks.
Mm-hmm.
No, but punching a hole in the joint is you're pointing to your sacroiliac joint. Truly,
Mhm.
there is a problem. The problem is I had to punch a hole there. But still, the back pain and the leg pain you had before the surgery is practically gone.
Yep.
And you told me you're walking few miles now,
Yep.
just within few weeks after the surgery.
Yeah,
And
it
that-
probably was 2 weeks ago I actually made it. I was able to watch my grandson by myself
Good.
and take a walk when he was to
And
go get an
this
ice
is,
cream.
for people who understand spine surgery, that's a tremendous result.
Oh,
And
yeah.
even though your anatomy was very unfavorable, we still got the job done. Here is the pictures from the surgery. We put the spacer in, and we put 2 screws in the L5 and 2 screws in the S1. And the spacers, this is the spacer here. And
Okay.
practically, I'm very happy with the result. Everything looks perfect, but obviously healing is still ongoing. And hopefully in the next few months, you'll notice even more improvement.
Okay.
Now, the alternative to the surgery is open old-fashioned surgery, which is recovery is much longer.
Right.
But so far, it seems that we have achieved the result that we were looking for
Right.
just
Oh.
6 weeks after the surgery.
Most definitely.
Now,
Very cool.
any question for me?
No, just maybe sometime about work, because you're going to see me
Yeah.
again in.
Yeah, we see our patient way more often than most of other surgeons. We see our patient within 1 month, within 4 months, within 6 to 9 months, after a year, and even 1.5 years. So we'll all set it all up. We will follow you clinically, and that's part of our protocol to really see what we have done. Okay?
Okay.
Well, thank you so much for the
Well,
interview.
Oh, you're welcome.